Hello, and welcome to this episode of What You Need to Know. On this episode, we look at what you need to know about depression. To help us look at this topic, we are joined by Mr. Happy Zulu, a clinical neuropsychologist. Before we begin, it is important to note that the information shared on this platform about the different medical conditions that we are going to look at in this series is a general overview. It is basically what you need to know about these medical conditions so that you're able to make informed decisions regarding your health. That being said, here is what you need to know about depression with Mr. Zulu.
Hi, speaking to you here is Happy Zulu. I'm a clinical neuropsychologist, and today I will be discussing depression. Depression is a serious but common mental health disorder that affects many people. And so it's characterized by thoughts and feelings of intense sadness, which usually take a period of more than 2 weeks. So depression goes beyond the normal feelings of sadness or feeling low. It's got to do with intense feelings of sadness, where an individual loses interest in activities that they usually enjoy, the day-to-day activities, and an individual may lose appetite, or they may have problems with sleeping. So clinically, we basically look at 5 major types of depression. The first type of depression is what is known as major depressive disorder, or MDD. And so this is characterized by intense feelings of sadness, or somebody feeling very low as a result of grief, or whatever could have caused that depression, and it lasts for a period of more than 2 weeks. The second type of depression is what is known as persistent depressive disorder, or PDD. And so this is long, though mild in most cases, but as I indicated, it's long, so it's chronic form of depression. And an example of this is where someone loses someone very dear to them, either a child, a parent, or a sibling, and they experience this sadness for maybe 2 years or more. So this is persistent depressive disorder. Then the third type of depression is what is known as bipolar disorder. And as the name suggests, so this is where you have shifts or swings in maybe the mood of an individual, where they're feeling very happy, which is known as mania, and then all of a sudden they feel very sad, which is the depressive episodes. And so this is similar to, or maybe connected to, what others may call personality disorder, and so this is bipolar depression. So the fourth type of depression is what is known as postpartum depression, and as the name suggests, this affects new mothers. So there are some mothers, just after giving birth, you find that even if they have never experienced intense depression before, they would experience depression, and sometimes they would feel very low, and sometimes even take the lives of their own children, or even not breastfeeding them. And so this is postpartum depression. And a serious form of that depression is what is known as postpartum psychosis, which is usually characterized by a mother trying to harm themselves or even harm the child by taking the life of their own child. And the last depression is what is known as seasonal affective depression. Although very rare, but this is depression where an individual is depressed as a result of the weather, maybe intense coldness and things like that, and it causes depression. So basically these are the 5 types of depression as we categorize them clinically. So regarding the causes of depression, we basically look at 3 major categories of causes. So the first one is biological, then we have psychological causes, and then we have environmental causes. So biological causes, for some reason, depression seems to run in families. So if you have a parent or both parents or even a very close relative who has experienced depression before, the chances are high that you may also experience depression at some point. Of course, there are several other factors, what are known as precipitating factors, at play that would necessitate an individual to be depressed. And also the brain chemistry and the mechanisms in the body. So we have neurotransmitters such as serotonin and dopamine that may affect our motivation, or that may affect our moods. And if there's an imbalance of those neurotransmitters, it's possible also that an individual may be depressed. And then certain hormones also, if there's an imbalance, it's possible that an individual may actually experience depression. Then we have psychological causes. So if you have experienced trauma, maybe seeing someone being shot, or losing someone very dear to you, or losing something very significant in your life, or distorted relationships, for example, it's possible an individual may go through depression. Then we have environmental causes where individuals losing jobs, for instance, what is happening currently, where a lot of people have lost jobs unexpectedly and abruptly. It's possible that may also lead somebody to be depressed. So these basically are the three major categories of depression. So look at signs and symptoms of depression. So I should state here that doesn't mean when you experience this, then certainly or definitely you are depressed. It could be signs and symptoms of maybe other issues happening in your life. But when you experience intense sadness, especially sadness that lasts for quite a significant period of time, especially for more than 2 weeks, it's possible that you may be depressed. And those feelings of feeling very low and feeling hopeless or weightless, and in some instances having ideations or thoughts of taking your own life, that could be an indication that you are depressed. And there is also where an individual loses interest in activities that they usually enjoy, and it could be an indication that someone is going through depression. And if there's a significant change of behavior also, maybe sleeping less or having issues with your appetite, that could have happened as a result of something terrible that happened in your life, for example, that could be an indication of depression. So human behavior is complex, so it's not that all the people behave the same way when they are depressed. So for example, the majority of the people may lose appetite, or they may have insomnia, have problems sleeping, but for some people they may sleep more than usual or eat more than usual, and that could be as a result of depression or going something that was traumatic or having a traumatic experience. So basically these are just signs and symptoms of depression. So whenever someone experiences these signs and symptoms of depression, it's important that early intervention is sought. And so if you're the one who is experiencing this, it's important that you reach out to others who may try to help, or you reach out to maybe psychologists or counselors or therapists who may help. Or if you notice, it could be a friend, or it could be a co-worker, or anybody that you know, it's important that you try by all means to reach out to them or advise them to seek professional help. And there's even if this is a serious mental health disorder, interventions are possible and interventions are there. So please reach out to it could be the nearest health facility, and those people may be able to help you or refer you to institutions or facilities that will be able to offer therapy or offer counseling services and so forth. And so one of the interventions is what is known as cognitive behavioral therapy, where maybe the therapist try to work on the thought pattern of these individuals who may have, for example, lost hope or have those feelings of taking their own lives. And in some cases, especially when this individual sees a psychiatrist, they are and depressants that may be prescribed to these individuals. And please don't prescribe these medications on yourself, because you may not necessarily need those medications in the first place, or you may even take wrong medications. So please seek help, professional help, if you think you are depressed, or if you think those people who are close to you, whether they are friends or relatives, if you think they are going through depression, it's very, very important that you seek help. In cases of suicide, suicide is always considered as an emergency. So it's important to seek help immediately when you think somebody is depressed and maybe they have those thoughts of taking their own lives or even taking the lives of other people. So there are a number of myths and misconceptions regarding depression. For example, some people say depression is only for women, or it's only for old people, so anyone can experience depression. The same way you're okay now, and just a few minutes after you're involved in an accident or something like that, it's the same way all human beings may experience these mental health issues, such as depression. So anyone can experience or suffer from depression. And some people think depression is only for those people who are weak. No, even the people that you consider very strong may also experience depression. And some people say it's only for males, for females, and males cannot suffer from depression. Like I mentioned, any human being may experience depression. Some people think that depression is just sadness, which is not true. Depression is actually a mental health disorder, so it's intense sadness. Usually that takes a prolonged period of time, like a period of more than 2 weeks. So it's not just sadness. And it's not only women who are depressed, even males may be depressed. And it's not only adults who get depressed, even children or younger people can get depressed as well. So depression is a condition which may affect anyone and everyone. So in conclusion, we should all understand that depression is a mental health disorder and depression is real, and anyone and everyone can experience depression. But even if it's a serious condition, treatment is possible, and there are different forms, there are many forms of interventions, including behavioral interventions as well as medications in cases where medications have been prescribed. So let's try to be on the lookout for others. If we think we experience these symptoms and signs of depression, let's try to seek help. If we notice our relatives or those people who are close to us, it could be workmates or colleagues, it's important that we put in those interventions timely, especially in cases where people take their own lives. It's an emergency, so it's extremely important that we reach out to them and offer that much needed support, social support that we all need.
Thank you for having joined us on this episode of What You Need to Know, on which we were looking at what you need to know about depression. If you have any questions, be sure to leave them in the comments or send us an email to the address on your screen. Until next time, take care of yourselves and take care of each other, because we do care about you. Goodbye.